All right, now we're going to learn how to do a ponytail. Okay, this is my wife, Cindy. Say hi to the YouTube.
Hi.
Tell them what happened. If you didn't understand, she had a hemorrhagic stroke in her brainstem in May 22nd, 2023 at 11 a.m. Today is November 28th, 24. Okay. Now, lean more forward. I don't understand how I get it from the top of your head, though. Pull it up. Pull it up like that.
Yeah.
Jesus, there's a lot of hair. Anybody out there don't know, women's hair is very complicated. You can't just spray water on it. You can't do a lot of stuff to it you'd think you'd be able to. Well, how's that? Well, that's horrible. We better try that again. Okay. This is my first time with the up high ponytail. Do you brush it from the bottom up? Well, that's because you're a girl. You know what you're doing. Or dads that have girls that my daughter didn't wear a ponytail like this. It was down low. Ooh, I got that one much better. Now we're going to start doing a lot of videos here and showing people how to do things like this. Oh, what do you think? Better?
Yeah.
All right. Now, what else should we do for the camera? Brush your teeth? Okay. Now, that is a complicated one. Now, people think that brushing the teeth is just brushing teeth. It is not. Not after somebody's had a stroke or something to where they can't do it themselves. Now, she has a trach, so, and her mouth gets dry and icky. Biotin keeps her mouth dry, plus it keeps away any infections. And if somebody's had a stroke or something like this, infections in the mouth and the bad spit, the bacteria in the spit develops over the day is bad for them. So you have to be diligent about brushing the teeth. We do it every day. Every time she goes to eat, and every time she goes to eat something, we're practicing getting rid of the trach. So she does squirt bottles and suckers. Right now, you have to do the care for the mouth before she can be doing a sucker or the spray bottle every time. Now, even sometimes I just hit it with the biotin and make sure there's no bacteria built up. If you can't afford the biotin, well, I don't know. This is the best stuff for her situation. We did the research and it is. And we talked to the dentist. and doctors, and they all agree that this is the best. I mean, any mouthwash that you kill bacteria with is going to be good, but remember to be careful. Okay. And for suction, there's all different kinds. We got this one from the hospital. They'll give them to you free at the hospital when you go. And if you have anything like this, then of course you're going to be going once in a while. Keep it very clean because it's going to go in her mouth. There's always lots of noise. Now, water comes out of the city tap, we all know, or even the well. It will have things in it. Sterile water. Now we use sterile water so that way there isn't any kinds of bacteria in there at all. And you want to continually rinse off the toothbrush and use fresh water. I dump it often. Always, always, always wear gloves. I don't touch anything without gloves. Except for that time I did because this is my first YouTube video, so and I get plenty of toothpaste in here. I use the liquid toothpaste because it mixes a lot better. So I don't have clumps of toothpaste that she might swallow. Because anything that goes, she doesn't have, from being on the life support so long, they had to give her a trach and she damaged her larynx, her voice box. So it doesn't close like that normal. And she had locked-in syndrome, which is a whole complicated thing all on its own. So this stuff or anything will go down your lungs, and if it goes down in your lungs, it'll create pneumonia. We haven't had pneumonia yet, so we're not about to do that. So you have to take very good care of everything you do. Be careful. It's not a big deal. She'll get grumpy if I'm going slow. And I do the gums first. Very important to massage the gums because normally when you eat, it will do that for you. She's not eating, so her rent cavities or gum disease. I want to make sure to massage the gums with the toothbrush. Get them nice and clean, get all that icky out of there. Now I dump this constantly dump it. I don't want to put any bad bacteria back in her mouth from rinsing off the toothbrush. I have a cup over here that I dump it into. Now I want to make sure that what I make sure is there's nothing icky in the water when I'm done rinsing it. If the water changes colors, I add more water and I go at it again. Not, see, like now I will do her upper gums and then I'll do her teeth, and then you'll see I do everything more than one time, so that way at different stages, so that way it's guaranteed to be clean. No pneumonia, no infections. Number one rule, we don't want to end up in the hospital. and get nothing underneath, get the palate, get everything. Rinse, dump, and repeat. May seem like overkill, but we have not. This will be on the 28th of this month. Will be 1 year that she's been out of the rehab facility, and we have only had one night in the hospital for the thrombone injection in her artery from she had a leaky artery from an exam she had where they did an angio on her brain. Thought we had a great doctor up at the UW. Put that cool shot in there, and it just, God, that was amazing. Okay, now that's my first go around of the gums and the palate. No, I am not trained. Well, I'm trained. I got trained in the hospital. The nurses were gracious enough to start teaching me while she was in the ICU, and then on to the third, fourth floor, where I started learning trach care right away and everything. Because my plan was not zero chance I was going to leave her alone. I went every day. If you have any cavities, you need to get checked out right away. Any infections in the mouth causes bad bacteria to go into the lungs, causes bad bacteria to go into the bloodstream. And we don't want that. Any bad bacteria is bad bacteria, which causes a problem. Problems cause hospital visits, cause her to get sick. She gets sick, she can die. It ain't no joke, so we don't screw around with it like it is. Everything has to be done perfect. And she just got done with her albuterol, so she's a little bit congested, but we do the albuterol and then the teeth brushing usually at the same time. But I don't think you'll be able to hear us over the albuterol machine. Now I'm really only brushing one side of the teeth at a time. Yes, I use the toothbrush on both sides, but I'm just using it to knock off some junk on the other half. It's much harder than you would think to brush somebody else's teeth. But we were down at the farm stand picking up some vegetables and fruit to blend up for her snacks in the G-tube. Use the bullet grinder, not a regular blender. It doesn't seem to blend as well as the bullet. teeth are clean on both sides now. The gums are clean. I'm telling you, it may seem like overkill, but don't mess around with this stuff. You gotta do it right. If you don't do it right, bad things can happen. I listen to the professionals and I do it like they told me. Then I went a little more into it because I got OCD or something. I don't know. I'm very cautious. There we go. Now, when Cindy got home, she couldn't even hold the suction or anything herself. So, I had to do all of it. That was very complicated. Let me tell you, when somebody can't help you with all this, when the person you're doing it to can't help you, holy crap. Is it hard? So hard. First few months were very, very, very long. Still very long days. Just different reasons. Now, I'm not done at all. That's just the first go around. Now we got the teeth clean. Now just make sure that they don't get dust. Gum, teeth. Dump that water. Don't use the water over. You don't want to see any drippy, icky, bacteria infected saliva. You want none of that when you're done. I get rid of my toothpaste cup, brand new cup. Don't need very much in here. And that's good at $10. Whack. Keep swallowing my snooze. Make sure you get the gums. Sometimes I do that. Wrong cup. Rinse it in the mouthwash. It happens. But throw away the cup. Start over. Don't want any bacteria in there. I don't care. It is what it is. It happens. Things happen a lot. Gotta do everything over a bunch of times sometimes. Got the gums. I'm gonna get the teeth. Make sure they're good and coated with the biotin. Put my cups on the wrong side. Don't want to do that. Copy. Cindy does not have a gag reflex. Somebody who's been paralyzed, a spinal cord injury. She has her brain hemorrhage was in the artery in the brain stem. So there's some forever things. Just as somebody is paralyzed, she has some of those same problems. She's not paralyzed, not anymore. She was in the beginning, that's for sure. That locked-in syndrome is very scary. Now I'll do the tongue one more time. Okay, and then while she's finishing that up, I'll throw away the cup. I usually go wash the toothbrush out, but you don't want to sit here and wait for me to do all that. Now, then the suction catheter that we use, or actually the device is not a catheter because it doesn't go anywhere. I clean it with this. 50% Listerine and then the rest of water. Of course, it's distilled water, not sink water. I don't use the other water for this. I just use distilled. Disinfectant wipe and a paper towel. This is every time. So she's done, and what I'll do is I'll put it in, make sure to suction plenty up in there. I don't just stick it down there, make it kind of work for it so it gets more all around inside the suction. Now I'll disconnect it. Make sure to clog. Let it get all sucked in there so you don't have anything hanging out. Then disinfectant wipe. Make sure to get the whole thing. Very good. Every couple days I'll take and put hot water through it and some peroxide. Then hot water again. Make sure there's no peroxide left, obviously. Okay, and that's brushing your teeth.